So essentially, yeah, anybody can develop one of these if you've had an amputation or a laceration of the nerve.
Yeah.
Oftentimes the nerve just doesn't heal well, and it ends up curling up on itself and becoming this massive ball of painful nerve endings.
Yeah, it's like a little fiery poker in your foot where you just can't get rid of that pain.
And so unfortunately, for the last 100 years, the traditional treatment for this, if non-surgical options have failed, is cut the nerve out.
Yeah, this neuritis, not this neuroma.
And it's the only nerve entrapment in the entire human body where our first choice has traditionally been to cut it out. It doesn't make any sense.
Yeah.
Right? You wouldn't do that in the hand. Why do you think it's a good idea in the foot? So anyway, that should be your last resort. And so your original options, when things like maybe a steroid shot or two don't seem to help, maybe changing shoe gear.
Shoe gear, stretching, steroid shots.
Clearly wearing tight shoes is going to compress those metatarsals, diminish the space that nerve has to live in, and you're going to have problems. But this is a great picture. I think the misnomer is that the nerve has to look like that in your right-hand picture there. Yes, the nerve's getting irritated by the ligament, but they don't look like that oftentimes. They can be this spindly little nerve that's just as painful.
Yeah.
So that, if they all looked like that, I could see why, okay, maybe we should excise them, but they don't. And so just simply getting rid of the ligament is helpful about 90% of the time. We've been doing the derm decompression on these for, I've been doing them for 20 years now.
Yeah. So the technique that Dr. D is talking about is called your Morton's endoscopic nerve decompression, also known as your endoscopic decompression of energy or neuritis, Eden or MEND or whatever you want to call it. Mm-hmm. It's just like how you talk about carpal tunnel surgery endoscopically.
Right.
You go in, small port, and you literally release the band of tissue that's coming in and over that nerve, giving that nerve some wiggle room. So here's kind of what it looks like. Yeah,
this is there's the one in the picture in the middle. That's the Kobe. So that's a blind technique, which I'm not, diminishing. I think there are folks that probably do that quite well. I just don't prefer it because I like to be able to visualize it. I can do the endoscopic technique with a 2.7 millimeter scope where we can actually visualize the ligament in like 8 minutes.
So we're talking about going in literally 2 small ports, 1 centimeter each, and releasing that nerve and having nearly a 90 plus percent success rate.
95% success rate, where you don't need to take the nerve out.
Yeah, versus a 4 centimeter plus incision either on the top or the bottom of the foot, depending on your technique, and you're removing that nerve, and you're going to have residual numbness in that foot, and you'll have the risk of having a stump neuroma,
which could be 10-15%.
Yeah.
So that's a big difference. That's statistically significant.